Hello everyone, welcome back to Inkmed. If you are preparing for a NEET PG INI-CET FMGE Upsc Cms, this video is one of the great highest yield respiratory medicine revision you will watch. Today we are going to 40 classic clinical scenario. These are the kind of clues examination repeatedly asked in PYQs and clinical based question. Don't try to memorize the entire sentence. Instead of identify the trigger words, and once you recognize those trigger words, the diagnosis becomes almost automatic. Let's begin. COPD. A question is a chronic smoker presents with chronic cough. Spirometry after bronchodilator shows a FEV1 by FEC ratio below 0.70. What is the diagnosis? The answer is COPD. How to remember is the biggest trigger here is smoker plus post bronchodilator, FEV1 by FEC less than 0.7. Whenever you see the post bronchodilator obstruction that persists, think COPD. The trick is smoke stays, obstruction stays. If obstruction remains even after bronchodilator, it is COPD. Example: asthma improves significantly after bronchodilator. COPD does not completely reverse. Next, alpha-1 antitrypsin deficiency. The young non-smoker develops emphysema along with liver disease. The diagnosis is alpha-1 antitrypsin deficiency. The trigger words are young, non-smoker, emphysema, liver disease. Whenever these four come together, immediately think alpha-1 antitrypsin deficiency. The trick is young lungs, young liver is alpha-1. Example: emphysema in smokers is common. Emphysema in a young non-smoker should immediately make you suspect alpha-1 deficiency. Next, bronchial asthma. A patient has episodic wheezing with reversible airflow obstruction. Diagnosis: bronchial asthma. Trigger words: episodic, wheeze, reversible obstruction. The trick is asthma comes and goes. COPD stays. Asthma returns to normal after bronchodilator. Example: if the question says reversible obstruction, don't overthink. The answer is asthma. Next, a non-asthmatic has eosinophilia, central bronchitis, and very high IgE. The diagnosis is ABPA, allergic bronchopulmonary aspergillosis. The trigger words are asthma, eosinophilia, central bronchitis, and high IgE. The trick is 4 A's: asthma, aspergillus, allergy, antibody IgE. The example: central bronchitis is a favorite examiner clue. Next, the patient suddenly develops severe asthma. There is a silent chest and pulses paradoxes. The diagnosis is life-threatening asthma. Trigger words: silent chest, pulses paradoxes. Memory trick is a silent chest means silent because very little air is moving. No wheeze does not mean improvement. Sometimes no wheeze means the patient is about to arrest. Example: silent chest is an emergency. Never miss this in exam. Now let's move from obstructive airway disease to respiratory infection. Next, a patient has a fever, protracted cough, and lower consolidation on chest X-ray. The diagnosis is community acquired pneumonia. The trigger words: fever, protracted cough, lower consolidation. The trick is think 3 F's: fever, filled alveoli, focal consolidation. Example: the most common organism is Streptococcus pneumonia. Next, an alcoholic presents with the foul smelling sputum and cavitary lesion. The diagnosis is lung abscess. The trigger words: alcoholic, foul smelling sputum, cavity. The trick is alcoholics aspirate. Aspiration leads to anaerobic infection. Anaerobics produce foul smell. The example: whenever you read foul smelling sputum, things anaerobes until proven otherwise. Next, the patient develops cavitary pneumonia after influenza. The diagnosis: Staph aureus pneumonia. The trigger words are post-influenza cavitation. The memory trick thing: flu first, staph second. This is one of the oldest PYQ session. Example: post-viral pneumonia is classically caused by Staphylococcus aureus. Next, The HIV patient with CD4 count below 200 presents with dry cough and bilateral ground glass opacities. Diagnosis is pneumocystitis jirovecii pneumonia. Trigger words: HIV, CD4 below 200, ground glass opacities, dry cough. The trick is, remember, 200 means think PCB immediately. Okay. Example: the drug of choice is TMP SMX. It is called trimoxazole. Next, the patient has chronic cough, evening fever, weight loss and upper lobe cavity. Is pulmonary tuberculosis. Evening fever, weight loss, upper lobe cavity, chronic cough. The trick is, remember the TB4: persistent cough, weight loss, evening fever, upper lobe cavity. If you see all four together, tuberculosis should be your first diagnosis. Example: upper lobe involvement occurs because Mycobacterium tuberculosis prefers high oxygen tension. Before you leave, here's something that can genuinely help your preparation. We are conducting free daily tests exclusive for serious aspirants on our WhatsApp channel. At 1 o'clock p.m. NEET PG daily test, at 2 o'clock p.m. Upsc Cms daily test. To keep the discussion focused, only the first 50 participants are allowed in each test session. The topic for each day test is announced in advance in our WhatsApp channel and Instagram page, so you can revise before attempting the test. If you are serious about improving your rank, join the channel, turn on notification and don't miss the daily practice. If you found this video useful, like it, share it with your friends, subscribe to Inkmed, and I will see you in next part where we will cover scenarios. Thank you for watching.